There are some circumstances where children with fevers are concerning. If any of these pertain to your child, it is recommended that you seek care for your child. Additionally, if one of your child's healthcare providers has given you additional recommendations based on your child's specific circumstances, then those should be followed as well. Well, let's talk about the concerning symptoms. If you have a baby with a fever that's under 3 months of age, newborns, particularly 2 months of age, but sometimes up to 3 months, should go to the ER because their bodies are so new and their immune systems just aren't strong enough to fight infection. They are at risk of having a severe infection. So therefore, it's important that they get tested and checked out because we don't want to risk missing anything. If your child is immunocompromised or has any medical conditions such as sickle cell disease or certain heart problems. Additionally, if your child is unvaccinated, this is because unvaccinated children can be at risk of serious infections that vaccinated children aren't because they don't have that vaccine support in their bodies to fight those infections. Treatment for a child that's unvaccinated really depends on where they get care because some providers want to do blood work every single time an unvaccinated child gets a fever, while others only do testing if there's other concerning factors. If your child has a fever after being in a very hot place, this could be outside in the summer, for too long, or in a hot car. If your child has a febrile seizure, I know this can sound really scary, and I'll have a part 4 that will go over just febrile seizures. If your child has a fever that's repeatedly over 104 degrees Fahrenheit, if your child looks really ill, is really fussy, is really difficult to wake up, drowsy, or lethargic. Also, if they don't feel any better after their fever is brought down. Now, this isn't going to happen instantly, but it should happen shortly after medication starts to work. It's typically about an hour to an hour and a half after giving a medication to help with the fever. If your baby seems to be getting worse, this can be an expected symptom. Say if they have a virus and day 1 they're okay and day 2 they're getting a little worse because that's the normal progression of a virus. But anything beyond that, it can be concerning. If they have any other symptoms that require treatment, such as a stiff neck, trouble breathing, dehydration. And lastly, you should get your child checked out if you're concerned about them because parents are the best advocates for their kids. And if you're worried about them, it's a good idea to get them seen.